So this is really what you can do yourself. This is an adjunct to what I've been saying before, that if you can actually touch your own pain. Now, I have to tell you, it's not that easy getting round behind your back, and you'll see me doing it in a moment. Believe it or not, you will affect quite a good deal of positive response from that. Not only because you are bombarding the brain with a different impulse from the periphery, i.e. your back, up to the brain, so you're competing with the pain, literally, paling the pain out to the side, because you're touching your back in a sort of knowing way, like a therapist, knowing that there is a possibility that you can help and getting all the good descending inhibitory feelings and sentiments from that. But you can actually effect some loosening, because by you touching your own segment that's sore, and you'll feel it sore, you actually help switch off the muscles that are in spasm and binding that spinal segment tight. And I'll take you through it. You can actually feel through your skin those spinal knobs that you know so well. The problem one will be always much more sore, typically like a bruised bone, if it's the disc problem primarily. If it's the facet problem, you'll dig in further out to the side of the spine, about 1.5 centimetres out to the side of the spine. You'll pummel your hands or fingertips in deeper and elicit a different type of pain, a sort of pain that craves pummeling. And that will have that double whammy of effect of physically loosening, triple whammy really, physically loosening, switching off the muscles and creating that competitor sensation to the brain to compete with the pain messages. So you can treat your spine yourself. You won't feel very good at it. It is rather hard getting the right amount of pressure from the direction you're approaching from. Rest assured, everybody feels that, including me. The important thing is to be comfortable lying on your side with a pillow under your side waist and your knees bent at the front so that you're stable and your spine isn't twisted. You can see the dimple there, which is where the pelvis joins the side of the sacrum, and L5, the bottom vertebra, is approximately at that level. So higher than you would think. So here comes my hand in from the right, approaching L5 from the right, pressure mainly exerted through my middle finger, reinforced by the strength of the other fingers, and I'm going up the spine, 5, 4, 3, 2, 1, with the problem vertebra, the sorer ones, the more shrill, the discomfort, like a bruised bone. Here is the spine inside lying, 5, 4, 3, 2, 1. These are the spinous processes, which is the knobs you can see through the skin. These are the facet joints, which we get to in a moment. This is the back of the sacrum and the coccyx and the pelvis either side. So you're lying comfortably on your side with your knees bent. And my fingers are coming in from the right, mainly exerting pressure through my middle finger, reinforcing with my other fingers either side. Tiny little amplitude pressures from right to left. You can't get much pressure up and you don't get much movement, but you get a very valuable bit. And the most problematic vertebra feels the most painful. The pain is shriller, and you get a sense of wanting to stay there. So here I am coming up from below, hooking my fingers under, again from the top of the spine down, hooking from left to right, playing around and searching with my fingers, looking for the pain. Now here I'm going more to the facet joints, and you can see the facet joints better on the top. There's the chain down either side, L5S1, 4, 5, 3, 4, 2, 3, 1, 2. You can see them there. You can't see obviously enough the facet capsule, which is like a sleeve, like a dome, if the joint itself is inflamed. And to actually access the facet joints, you use much more the point of your fingers piercing straight in, so not pulling the segment sideways, and you're plunging your fingers in about 1 centimetre to 1.5 centimetres out to the side of the spine, and see my fingers going straight in there. And you can see there that my fingers don't go in as far there, so I've obviously got a problem at that facet joint. There's more thickening under the skin there. And it feels agreeable. It almost craves pummeling there, and one almost can't get the right amount of pressure, adequate pressure one senses with the fingers. Be assured you are being effective, and you would only do that for about that long. Really only a minute or a minute and a half, once a day only, followed by the back block on the floor.